Good evening. Welcome back to my no-name channel. I'm Bruce. This is another Bali COVID-19 update for December 27th. The year is almost over. Thank goodness. Okay, what do we have today? So, let's look at the numbers first, like usual. And the numbers have been up over 100 all week. Let's put this down. Numbers have been up over 100 all week. But yesterday's numbers, 96. New cases, 17,033 total. And we have 15,564 recovered, 501 deaths, and still under 1,000 with active cases, 968. So, okay, that's holding steady. All cases were Indonesians, 89 were local transmissions, 6 were domestic imports. Okay. Domestic imports, okay. We'll talk about that soon. And 1 was international import. And the numbers for the regencies, Badung 27, Tabanan 29, Denpasar 26, Gianyar 11, and Jembrana 3. And okay, unfortunately, not a lot of good news this week. With the holiday weekend, our cases are still there. They're not going away. We're going to have to wait and see what happens after the holiday weekend here, because despite the earlier request for people not to travel, and then the request for people to travel and then not to travel again, and then adding all the testing necessary, there are people here, a lot of domestic tourists. Kuta was packed last night, the street, just like old days. Today we were out in Lovina, in Kalibukbuk. We only saw three foreign tourists, but a lot of domestic people, which surprises me, because this isn't really a place. Oops, this isn't really a place for domestic tourists generally. There's not that many activities. It's kind of like old Europeans, Americans, people that like the more natural setting up here. Anyway. Let's go on to talk about vaccines. Okay, so we have 1.2 million doses, and I talked about that in a previous vlog of the Sinovac vaccine, but we're still waiting on the approval from BPOM, the Food and Drug Monitoring Agency, for the issuance of the emergency use authorization. And according to the head, they said they were observing Sinovac's coronavax vaccine, but that the observation period could take 1 or 3 or 6 months, and so it's not going to be approved for use for a while. But the government still says, the national government, Pak Jokowi still wants to get things going in January, so not sure how that's going to work out. But the BPOM also said that there is no critical side effects from the virus at this point, from the vaccine at this point, so that it looks good to go as of now. And Indonesia has orders for another 140 million doses from Sinovac, and 20 million from Novavax, which is a U.S. company. So that's 160 million doses. And the plan is to vaccinate 182 million people. What? Is that right? Yeah, 70% of the population, around 182 million people. So don't have quite enough vaccine yet. And so the vaccine, just like it is in a lot of countries, Korea, right, Japan, there's issues about the vaccine and why people didn't order it. President Moon in South Korea, his ratings are like down at around 40% now because people are unhappy that the vaccine is not available. What's going on? What's going on? And I asked people in Japan, and yeah, I don't know. So a lot of places are not ready yet. The U.S., of course, is vaccinating people already. The U.K. is vaccinating people. So vaccines are available and are going on in some places, but they're not. It's not going to happen here for a while. And another interesting story, the punishments for anti-vaxxers. So I talked about this, I don't know, a month or two ago, that the government said that they were going to be mandatory. It was going to be mandatory to take the vaccination. And while the article that's linked down below here in the Jakarta Post doesn't say that it's mandatory, it sounds like it's mandatory because according to this headline, decision to punish anti-vaxxers under regional administrations task force. So the National COVID Task Force has said that regional administrations can punish people who refuse to take the vaccinations. The task force spokesman said, I quote, basically the decision to hand out punishments lies with regional administrations. Such an approach may be taken if it is effective in disciplining the public to receive the vaccines in order to easily build herd immunity. And as I said just a minute ago, President Jokowi is planning on starting this in January, but we don't have a vaccine approved yet, so I don't know how that's going to work. And, well, in Jakarta, last week they issued a new regulation, a fine of up to 5 million rupiahs for refusing COVID-19 treatment if you're sick, or the vaccination when it becomes available. So it still sounds to me like this is going to be a mandatory thing, but I know a number of people here, Indonesians, not foreigners, who are dead set against taking the vaccination. Especially if it comes from China. So, I don't know, how's that going to work out? We still have to wait and see. It could be by the time that the vaccinations start here, that the US and the UK will have already gone through months of vaccinations, and if there have been no huge number of side effects, quite possibly the resistance here will die down, ease out. Who knows? Okay, so, well, none of that's particularly good news. What is some good news? Well, despite tourist arrival, okay, good news, tourist arrivals. So, despite the fact that foreign tourists cannot come here and there are no international flights opening in January, despite what some people say, and some airlines had put scheduled flights into Denpasar. There was, I think I mentioned this last week too, a number of people who went, oh great, and they went to book, and then the airline canceled and said, oh no, we can't land in Bali, they're still closed. So we still have foreigners coming in regularly on the business visa, the 211, the B211, and domestic tourists are here. They're showing up in numbers, like I said, Kuta. My guess is that if you went up to today, if I had gone up to Kintamani, where all those coffee bars are along, and that was in my Kintamani Ubud trip. You might want to take a look at that. Some nice views there, well, as I was driving by. That's very popular with domestic tourists. There's some really nice views. People like to go and do some Instagrams and do their photos. And it's not hard to get to from Denpasar from Kuta area. There were a lot of people out today. Traffic in Singaraja was a beast. Going from here to Kalibukbuk was, wow, just major traffic. So a lot of domestic tourists, and in fact, because of that, it's been necessary to add on more testing stations at the airport, and so that's the next story. Okay, so let's take a look at the airport. So Bali Airport adds second test facility as domestic tourism increases. So we have all these planes coming in and people going out to Java and other places. So there were long lines that arrive with only one test facility available, and so they've added a second rapid antigen test facility to keep up with the influx of passengers because of the long lines and the crowding. And hundreds of passengers had to wait for hours, apparently, to get the test that required. The test cost 170,000 rupees, and the wait time is approximately 60 minutes, and it's valid for 3 days. So if you need to get tested at the airport, you can do that. But I would suggest getting tested before you go. Much more convenient, and it's easy to get tested. There are a lot of places now where you can get tested around the island, and 170,000 rupees, not too expensive if you have to travel. And so let's take a look at the issue of quarantines for people that are coming in. So I mentioned that you can't come in, you can't fly directly into Bali, right? And everybody, I think, knows that by now. And there is no indication of when that is going to change. It's not going to change in January. I can't see it changing anytime soon with all the cases we have. Over 6,000 yesterday, nationwide. We're getting 100 plus a day in Bali. I just don't see this happening, unfortunately. And so I was looking at some information on Jackie Pomeroy's Facebook site, and so quarantines for arrivals in Jakarta. Who got quarantined? You get quarantined if you're Indonesian. The government will pay for you to be quarantined. If you're a foreigner, you have to pay yourself. So if you're coming into Indonesia, make sure that you have your documents in order, because otherwise you're going to be sent to a facility that that the government picks. And I was taking a look at the ones, a list of them, and they run about 800,000 a day in Jakarta, and they're right around the airport. And so who gets quarantined? People with symptoms, people with dubious test results, okay, people that make these things up. There are forgers, and that's gone on since the earliest days of coronavirus here. People with overdue tests, and people that are arguers, people that argue with them about whatever. You never argue with officials in Indonesia unless you want some pain. They will get you. And so if I've come across this so many times over the years. I rarely argue with anybody anymore that's in the position of power, because it's pretty much a losing game. Some people like to do it, and yeah, some people win, but boy, it's just to prove that you're right about something, it's not worth it. Anyway, in solar backpackers, apparently from some select countries, I don't know, maybe immigration has, got it out for some people from some countries. I don't know. Okay, so if you're coming into the country, make sure that you've got everything lined up. so that you can get through. You don't want to wait and go through all this hassle. Traveling is enough of a problem normally, and in these times, even worse. Okay, and so one final thing. There's just so much. Yeah, so much. And this is about schools. Schools are not going to open. Where's my school stuff? Okay. We'll start with this. 80 teachers contact COVID in Bali, Central Java. I'm only going to talk about the Bali part of this. So 60 teachers were tested positive out of 2,600 that were tested in the Badung Regency. They took the PCR test, and they were administered as part of the Regency's plan to open the schools in January, because that's been the plan, that all the schools were going to open here in Bali in January. And I was going, yes, okay, Zoe, my granddaughter, can go back to school. So there's 60 teachers tested positive out of 2,600. And they were isolated and treated. This plan for the testing program is to test a total of 6,248 teachers and 1,502 other school staff in the Regency. And this was all part of the push to open the schools in January. But, it has been decided by the Denpasar city government to postpone the opening of schools until March at the earliest. The head of the Education and Youth Office, Iwayan Gunawan, said that there are several factors that need to be considered when starting face-to-face education again. First is the risk factor for spreading COVID-19 around Denpasar. He said the risk factor is 26.3%. That means when tested, 26.3 people out of 100 people who are tested are going to test positive. I don't know where he got those numbers, but boy, those are 26%. Huge. He also noted how dangerous this was for children. Imagine, this is a quote, imagine if the children were positive for COVID-19 and they had to be isolated and hospitalized without assistance. What about their psychological condition? So we prioritize children's health. Good. Okay, I like that. Second is the readiness of health facilities. If there are students who turn positive, so are there places for them to go? Right now, no. There needs to be, they need to get some facilities ready. What happens when you've got kids? What are you going to do with them? Kids that test positive. Third, school readiness. They have to prepare the health protocols, including spacing, desk apart, at least 1.5 meters. And some schools have already, well, a lot of schools have already started this. We received information from Zoe's school that, that process has been underway for a while. So that was third. Fourth, access to online learning. He said, if this is good, if online learning is working, then what's the hurry to do face-to-face when there's a risk factor involved? And so therefore, these are the four reasons why school is not going to open in Denpasar until March. Now, we don't know what's happening in Buleleng yet. We haven't heard anything from Zoe's school. I haven't seen any news reports from the Buleleng local government, regional government. So we'll see. So Pak Gunawan said that they're going to be conducting a simulation with several schools. This is interesting. That have met requirements of being in a green zone or yellow zone. So they're going to pick some schools, several schools. I don't know how many several is. And students and teachers are also going to have to come from green or yellow zone. If somebody from red zone shows up, they're sending them home. all health protocols have to be in place at the simulation school. Lesson time is going to be a max of 2 hours, 2 days a week. This is a simulation. The head of the Denpasar City Principal Work Conference, EY and Merdana, said that online school during the first semester went well in Denpasar. There were no significant problems. Report cards were handed out in December. Zoe got her report card. It was pretty good. And thanks to my son, Sam, for being her tutor and getting her through all that online schooling. And but he said that the situation is not optimal. Right, it's not. I don't like online schooling. I don't know who does. Well, maybe some college kids, but I don't know. Nobody that I've talked to, none of the teachers that I know, none of the students that I know, none of the parents I know, nobody likes us. But right now, that's where we're at, so we have to make the best of it. Pak Merdana said that all this information is being issued to principals around Denpasar so that they don't feel pressured and feel the need to give in to parents who are pushing to open schools. And of course, you understand why parents want schools open. If you've got two parents working, nobody's at home, who's going to take care of the kids? This is a problem around the world. So sometimes kids don't focus on online learning. It's not an easy thing for little ones to do that. Yeah, I've taught online children before. It's not easy. Teachers that are doing this, boy, I really respect what they're doing. I don't think I could do it. I had an online job teaching kids in China for a while, and it was just like, whoa. I was exhausted after 3 hours. I was just like, okay. So that's where we are. We're not in a great place right now. The end of the year, everybody wants to be happy. I was out today. We went to this restaurant. We had lunch. It was nice. The folks at the restaurant said, yeah, there's just, there's no visitors, no tourists. It's really, really quiet. We saw domestic people, or domestic tourists around, a lot of young people traveling on motorbikes together. I don't know if they're local people from Buleleng or they're from other areas. But there's domestic people, so there's some things are happening here. But yeah, this is hard. It's not getting any easier. So wear a mask, social distance, don't be an idiot. We want to get things back to normal as much as possible, and as quickly as possible. And if you can help by wearing a mask, wear a mask. I know it's not convenient. I say this every time. I was out, on the motorcycle today. I hate driving the motorcycle with a mask on. I've got my, mask, my glasses, my helmet. I feel like I can't see anything. But those are the laws. Those are the rules. I want to keep people safe. If I've got this, I don't want to transmit it to somebody else. So yeah, there's my rant for the day. Okay, so that's it. I hope you had a good Christmas, and I hope you have a good New Year. If you're here in Bali, follow government rules. Don't gather together in places. Stay at home with your friends. Follow the rules. Have a good time. Be safe. Be kind to someone today. Thanks for visiting. If you like this, give it a thumbs up. If you haven't subscribed, please subscribe. And I'll see you next time.